India could face down 1 lakh to 13 lakh confirmed cases of the novel coronavirus by mid May if the current trend in the growing number of COVID 19 cases continues, according to a report by the International Team of Scientists. The report, compiled by COVID 19 study group and interdisciplinary team of the researchers, said while India seems to have done well in controlling the number of confirmed cases compared to other countries like US and Italy in the early phase of the pandemic, the country is critically missing a key component in this assessment: the number of truly affected cases. This factor depends on the extent of testing, the accuracy of the test results, and the frequency and the scale of testing of people who have been exposed but do not show symptoms. The researchers include Debashir Rai from Johns Hopkins University in the US said. So far, the number of people tested in the India have been relatively small. In the absence of widespread testing, it is impossible to quantify the magnitude of community transmission. In other words, estimate how many are infected outside hospitals and healthcare facilities, the scientist wrote. Thus, our current estimates are at best underestimates for India based on early phase data. According to the report, it is essential for India to adopt draconian measures to act before the growth of COVID-19 infection starts to accelerate in the country. PM Narendra Modi announced a total lockdown for 1.3 billion people in India for 21 days, warning that the nation may go back 21 years and many families could be devastated if we don't abide by the lockdown rules. In the analysis, the scientists used data on the number of reported cases in India up to March 16 and applied tools of modeling disease transmission. They estimated the theoretical number of infected at any given time and compared projections for India against the US and Italy. The scientists, including those from Delhi School of Economics in New Delhi and the University of Michigan in the US, noted in a blog post on the platform Medium that the estimates may change as stricter restrictions are adopted by India. India, according to the researchers, has the most overstretched healthcare system, where it is hard to provide care even when the patient volume flowing into hospitals is normal. Citing World Bank data, they say the number of hospital beds per 1,000 people in India is only 0.7 compared to 6.5 in France, 11.5 in South Korea, 4.2 in China, 3.4 in Italy, and 2.8 in the US. Owing to this, the scientists say the predicted surge in the number of cases make it impossible for the healthcare providers in India to support the sheer volume of cases.